Ladies and gentlemen, welcome to Dr. Ron, Unfiltered, Uncensored. Guess what? Episode number 253. Just incredible that we have these many podcasts available to you. I want to thank you for your listening and support. We have an email address at drronradio@gmail.com, and we are Dr. Ron, Unfiltered, Uncensored. On Facebook and on Instagram, it's Doc Ron Radio. So glad to have you hook up with us, and we'll keep you up to date on what we're doing and where we're going. Ladies and gentlemen, today we have a guest, Dr. Dr. Repice, to talk about cryo. He's going to be in about 15 minutes after the hour. But I have to start the program by telling you that this program contains general medical information. The medical information heard on this program is not advice and should not be treated as such. The information is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. You should never delay seeking medical advice, disregard medical advice, or discontinue medical treatment because of information heard on this program. You are encouraged to confirm any information obtained from this program with other sources and review all information regarding any medical condition or treatment with your physician. So as you know, ladies and gentlemen, we've been doing this podcast for quite some time, and we're really enjoying it. And we always have an attitude of gratitude to our listeners, because gratitude improves our quality of life, and it is an antidote for negative emotions like myalgia, for chronic fatigue syndrome. He also treats athletes. But rather than me go through this list, we have him here live today to explain about cryosauna and what he thinks about it and what lies in the future. Dr. Ron, good afternoon.
Yeah, good afternoon to everybody. It's been a while since I've been on this show with everyone.
Well, we have Dr. Jerry and Dr. Dan as co-hosts now, and after you and I started this puppy about 4.5 years ago, it's been growing and growing and growing.
Yeah, that's outstanding.
Well, Dr. Ron, tell us what is cryotherapy and what it's used for, and what, if there's different kinds, why you prefer one more than another.
Right. Well, I mean, typically to start off with is most people don't understand the terminology. So cryotherapy confused with just ice pack therapy. So a lot of times if people are searching around in a given community, they may see a facility that seems to have something called cryotherapy, and it might just be a variation from an ice pack to a hot pack if it's a physical therapist or chiropractor's office. So when I started doing what is really in full-length name known as whole body cryotherapy about 3 years ago now, it's utilizing cold air to essentially help the body heal. And it actually it basically puts the body in a good form of stress, because in this society where, as I know you talk about quite a bit on your show, we're talking about stress. Prolonged stress elevates cortisol levels. Oh, got a ringer on the background there.
Oh, that'll create some stress, a little cortisol.
No, it just creates a pause. Just creates a break. So yeah, prolonged stress, as we know, increases cortisol level, and prolonged increase in cortisol can really suppress testosterone, growth hormone, and a myriad of other symptoms can unfold from adrenal fatigue. I know you mentioned chronic fatigue, and the big buzzword of the last 15 years, people are being diagnosed with something known as fibromyalgia, which is basically a medical term for just multiple areas of aches and pains that they branded into a name that typically is wrapped around just chronic stress. So whole body cryotherapy, getting back to what you were mentioning, we began, you and I actually together, began to implement what at that time was fairly new and very new to the general public in the United States, even though in Europe and back in Japan, this technology goes back literally to the late 1970s. And a Japanese scientist was performing cold air treatments on rheumatoid arthritic patients, so getting into autoimmune type issues and factors and general arthritises.
Hello.
And really, are we still connected?
Yeah, you're good. My mistake.
Okay. No worries. So, the arthritis is the general aches and pains. And so, as I was saying, in Japan and in Europe, it's, going on basically essentially a 40-year history of a technique that it just involves infusing cold air around the human body that essentially reduces the pro-inflammatory hormones. So you're reducing an inflammatory state, and you're also getting a localized cooling of the tissue, affecting, generally the issue of aches and pains, but it goes a little bit beyond that. It's just in the United States, the pro athletes are really the ones that made it known, and it's become really, really popular lately. So we were, 3 years back, we're a little bit ahead of the game. Some of the pro teams, like I found out directly from a few people that have direct connections with the Pittsburgh Steelers, they were using it in kind of what we're calling now just, they're doing body hacking, so to speak, just different things to test the body and redo blood samples and seeing what essentially can biohack the system to look toward that panacea or that anti-aging secret, or for athletes give them the advantage where they aren't going to get into issues of drug testing and things that are outside of the rules and regulations of the game. So my interest in it was just not having that entity really in natural form to help somebody heal from the inside out. As a chiropractor of 23 years, working on people from spinal connection, neurologically, outside in, checking for fixations, checking for stiffness, muscle spasm, obvious tenderness in the muscle tissue, in the various joints of the body, and getting those areas moving better. That's one essential component. But at the same time, we have to look at, as you get into the foundation, or what's the fundamental cause of why people may be in pain. So whole body, wrapping it back to whole body cryotherapy is essentially the best part about it. It's a 3-minute treatment. People know what saunas are for the most part, and it's something I know you've been really diving into, and I've been promoting quite a bit myself. But instead of it being hot, whole body cryotherapy is typically there's a stand-up booth. It's almost like a stand-up tanning bed that you step into, and we infuse cold air. In our case, we use liquid nitrogen that's vaporized into the chamber. And it can produce essentially an extremely cold temperature, but because the nitrogen is dry, it's an invigorating effect rather than an uncomfortable effect at all. So it's a very tolerable process, even at the upper ends of minus 300 degrees, if you can imagine that, especially when you think about an ice bath being generally on average mid to upper 50 degrees in the positive side of the frame, getting down to a negative 200, 250 degrees Fahrenheit. Is very, very doable without any issues of skin burning or frostbite or what have you in that 2.5 minute to 3 minute time frame. And we have that very well dialed in, especially after 3 years of testing, this in our own clinics. That right around the 202 to 250 degrees seems to be really quite just and comfortable for all ages. We have, teenagers as young as 13, and I've had people over the age of 100 go through a 3-minute cryotherapy session for a variety of reasons as well. Some, it might be a hip. We certainly have in Florida, we have a lot of golfers and tennis players, so the hip, the shoulder, the elbow areas are real common. Of course, your traditional neck and low back or sciatic type pain, also very common. And then we also have people that have caught on that it helps in just overall mood and affect, because it's an adrenaline and endorphin exchange, so it actually affects hormonal response. So people used it and have found it to be very very helpful in enhancing and enlightening their mood from very mild forms of depression. Also, because it is a metabolic boost, just as any form of exercise, as I'll get back to, it tends to boost your energy. And because it's boosting your energy and creating an adrenaline response, in contrast to feeling revived during the day, people tend to sleep really, really well at night. So that's another benefit. And kind of a tertiary benefit with nitrogen being a collagen renewal, it actually helps to replenish skin cells. And we've had eczema cases, psoriasis cases, skin issues that is nothing to do why I got into it, but you just kind of step into it, because when people get into these machines, they're just seeing a variety of great responses that are kind of outside, my premise as to why I got into it, mainly as you were opening with getting into opioids and people even taking over-the-counter Tylenol and ibuprofen on a repetitive basis, and the long-standing consequences, even as far as death. from something that seems as simple as an over-the-counter bottle of pills to help them, play their golf game to begin with every day. So the whole body cryotherapy is a great augmenter as people become more and more aware to help, limit some of these risks as people become more educated about some of the dangers of what seems to be, or in many people's minds, kind of a safe thing to take, such as ibuprofen or Tylenol, acetaminophen. Things have been around for, quite a long period of time.
Yeah, Dr. Ron.
Yeah.
I just had a quick question. Do you find that the cryotherapy enhances your chiropractic adjustments when in combination that way?
My answer would be yes, just because when people are not nearly as sensitive, when their set points are lowered, number one, they feel like they're in a place where they see some promise, so they're already feeling more positive about, if they're a person that's been a bit different medical practitioners and not really getting to where they had hoped to get to, it tends to open that door of promise. And then certainly, when they're less tender or less at a lower level of pain, I'm able to do a little bit more and get into a little bit more of my chiropractic work without, trying to be more tentative just because of their sensitivity or their set point at where they are. So I find that it does mitigate their symptoms or bring those pain symptoms down, that much quicker. And again, that would be kind of referring to more your moderate severe cases where sometimes it's very difficult to do a whole lot, whether you're a massage therapist, chiropractor, physical therapist, or what have you, just because, they're in a level of pain that is almost in the realm of needing medication, where again, the cryotherapy that I didn't have prior to 3 years ago allows me to entertain people in that category and hopefully, and I've seen it many times, help them to, steer clear of the prescription drugs.
And Ron,
yeah.
tell Dr. Jerry, Dr. Dan, and our audience that about the nitrogen. It's not nitrous oxide. You're not going to fall asleep. How are your clients positioned in the sauna?
Yeah, that's a good question, and there is some other products out on the market and some competitors that are misleading the public and claiming the term nitrogen being harmful or dangerous and what have you. And essentially, when I've been interviewed on camera, I've talked about a butter knife being dangerous. I mean, you can spread butter on a bagel, or you can stab yourself in the chest. I mean, essentially, nitrogen is what we're breathing. 80%, only 20% of our atmosphere that we're breathing is oxygen. So we're breathing nitrogen-rich air. So nitrogen is safe. It's not inflammable. The fire department, they know all about it. Not a concern, even though we have gigantic 230-liter tanks times 3 of them in our centers. So it's very safe, and what you're referring to is positioning. So as I mentioned, many people are familiar in this day and age with tanning salons or tanning beds, and the newer versions have been a stand-up form rather than lying down. And so our unit, you are standing inside a booth, but the booth has a lift or elevation system. So the only area of the body exposed by the cold air in its entirety is essentially from the lower neck down or upper chest down. So you're not even breathing the nitrogen vapor as it is, which is one of the things I find to be more beneficial, and essentially what I like a little bit better than a walk-in so-called booth or chamber that's head to toe, where you have to cover the ears, cover the mouth, maybe even the tip of the nose so you don't get frostbitten. And even more concerning for me is because I have an older clientele, those styles of technologies tend to have the person breathe in a certain percentage of cold air into their lungs, which if you're asthmatic, if you have COPD, any type of congestive lung disease, and that can be, or pulmonary disease, that can be certainly concerning or not to the best interest of the patient and or client. So I like the individual sauna booths that are one-on-one, that are monitored, by a technician or physician the entire 2.5 to 3 minutes. You're never by yourself. It's always monitored. You're talked with the whole time, just making sure you're comfortable. Because in our clinics, we run 3 minutes, but you can opt to just only do 2.5, although that's very rare that we have someone stop at 2.5 minutes. That last 30 seconds is really the invigorating portion of it that people tend to really enjoy as well, just that rejuvenation concept, even though that's, no pun intended, it's the name of our actual corporation, is Rejuvenations Incorporated. And that's really, what I love about it is rejuvenating. And so again, the nitrogen, we use medical grade nitrogen. Many centers are using what is known as food grade nitrogen, and medical grade is just the purest form of nitrogen. It's probably from a technical standpoint the safest to use to spray into a human body. something I certainly recommend people seek out is centers that use medical grade nitrogen. And again, I like the nitrogen fuel because it allows us to get to the coolest temperatures at those minus 200s and, from minus 200 to minus 300 degrees, which some of the other centers use electricity. And electricity at best, they claim minus 160. Any of the research I've read really notes that they can sustain a temperature at about minus 130 at best, which is still ridiculously cold. But the issue with electric, too, is it can't draw the moisture out. So it could feel even more intense or more unpleasant than a minus 300 degree nitrogen chamber or nitrogen sauna as we utilize. So it could be actually less comfortable from that standpoint, too, just the fact that, like an ice bath or like a cold shower or a cold pool, you can have some unpleasant sensation from that little bit of moisture. That's why with whole body cryotherapy saunas, you can't come into a whole body cryotherapy sauna if you're sweaty or, again, if you just worked out, because that sweat will freeze and actually cause microburns on the skin, because literally moisture will freeze in about somewhere in the neighborhood of 30 to 60 seconds. So the clients that get into cryo saunas need to be, dried off or, at room temperature, so to speak, not coming in damp or sweaty from exercise. But the nitrogen,
Dr. Ron, Dr. Ron, why don't you tell our co-hosts and our audience about why you are attracting mixed martial artists and athletes to this type of treatment?
Yeah, well, I mean, the athletes are the ones that really made it popular, but in our centers, we are getting quite a few, especially in the last, just in the last month, we've had several of the mixed martial artists, the karate studios have caught on to it, just because, when you're looking at boxing and martial arts, there's kicking and punching, and when you're sparring, those impacts to the body can cause bruising. We have fighters that have come in with broken ribs, just general overtraining. And that's really where the promise is with cryotherapy, because it's roughly a 50 to 60% more rapid recovery from overtraining or muscle soreness type of injuries. And it also boosts hormonal response. So they're seeing an increase in testosterone and growth hormone. So anyone in the athletic industry is going to definitely dive in and like those effects. But again, the overtraining, kick to the thigh, it could really set someone back, maybe 1 to 2 weeks, and, potentially be, recovered much more quickly in a matter of days with repetitive whole body cryotherapy treatment. So that's why, I think it's starting to spread around, our county here with the athletes, especially the martial artists.
Yeah, Dr. Ron, is there any contraindication if an athlete is, let's say, taking steroids and they're getting cryotherapy?
It's a great question, and I don't really know the answer to it. I mean, it might magnify that response. Again, depending on what type of steroid they're taking and those matters, I'm not certain. But in the natural realm, it's been shown to boost natural testosterone and release the growth hormone. So I'm not sure how that would overall fall into play with someone that's taking an exogenous injectables type of anabolic steroid. I'm not really certain on that.
Are there any other contraindications, any ailments or medications or anything like that the patients would have to be concerned about?
Yeah, the beauty of whole body cryotherapy is really the only thing we're looking to screen out is pregnancy and pacemaker. If you're female and you're pregnant, not a good idea. You're not allowed to run into a cryotherapy center for that. Or if you had a pacemaker. The other thing we really look at is any type of cardiovascular issue, such as if you've had a prior history of stroke, that could be something that could be a total contraindication. If you have phlebitis or any type of clotting, factors, that's something that we'd want to note, because it does create a massive perfusion of blood flow through the arms and legs, so it does increase that circulatory response. And really, the other one is high blood pressure, meaning in a neighborhood of 160, 180, even toward what would be all in all considered needing a medical attention or medical emergency. So other than really rampant or uncontrolled blood pressure, prior history of stroke, venous stasis, any type of thrombus, that's really about it. So there's really not a whole lot of contraindications other than those.
And it's okay for children? Is there an age limit?
In general, as an industry, the industry standard has been a minimum age of 13, and really the rationale behind it more than anything, and there could be some other reasons, but the main thing as I see it is height, essentially a height requirement, because we have to be able to elevate, an individual. So if you're under 4'7" or so, it's sometimes difficult, depending on the type of equipment you have, to get someone in a safe range so they're not breathing 100% rich air, nitrogen.
Dr. Ron.
Dr. Ron, go ahead, Dr. Dan.
Dan. Yes.
Hi, Dr. Dan.
We were talking about testosterone and the metabolic steroids and so forth. What about people that are on prednisone and have autoimmune diseases and things like osteo and rheumatoid arthritis and myasthenia gravis and anything else along those lines? Is there any contraindication for this type of therapy in this case? Has that been studied yet?
I don't know specific research to that effect, but I do know that essentially the reason why whole body cryotherapy is really born about was to treat just what you're asking, those autoimmune inflammatory conditions. So the goal would be, and we certainly had these cases over the years, is to, work toward taking a patient/client that's on prednisone or some form of corticosteroid and hopefully get them to a point where they don't need the pharmaceutical corticosteroid and can control that inflammatory state, or manage it, with a form of natural treatment like whole body cryotherapy. So that would be where I would see, working with the physician, seeing how the patient's response is to a different form of inflammatory, something that can reduce pro-inflammatory hormones, the pro-inflammatory cytokines, and do it naturally.
Have you had any experience with like dementia or autism treating with cryotherapy?
Personally, I haven't gotten into any of those realms. I mean, it is being used in MS cases. We do know that, the good types of stress produces, autophagy, the cleaning up of the senescent cells. So really cleaning out dead cells of the body. Same when we're looking at, the sauna therapy, the heat stress, the cold stress, those protein production. There is some research out there talking about BDNF, which is brain-derived neurotrophic factors. So definitely there's some evidence out there supporting, adaptation and neuronal response in the brain. So I think there's definitely a lot of promise with it. I just haven't had any direct experience or got kind of charted into that territory, mostly focused on the basis of joint pain and inflammation as a general whole in the athletic and elderly people that are just very active in this community.
Now, does the
it's
patient
basically a
need
stressor, right? It's a stress. It's a cold stress or heat stress, right?
Yeah, so cold stress or heat stress. That's a term that they use called hormesis. So it's the good type of stress because it's temporary. So you do get an adrenaline push. You do get a little rise in cortisol, but it's not sustained. And so that's the type of stress. Even with weightlifters or doing high intensity interval training for short bursts are really, really helpful in adapting the body and maintaining the overall integrity of the body. So they're the things that we like to see and are good. That we do see good responses to.
And the other thing that I'm sorry, Dr. Jerry. The other thing that we were talking about, when you expose your body to cold temperatures for short periods of time, you get this mitochondrial reset, and you get more brown adipose tissue. So to help people that are obese, have you seen that?
Yeah, and as you well know, I mean that's the kind of the real craze and buzzword right now when we're talking about Alzheimer's and dementia. In those categories is the browning of the fat or increasing in mitochondrial substrate, the mitochondrial biogenesis. So as you do that, you're basically for those that haven't heard mitochondria are the energy cells or organelles that produce energy in the body. And as we age, we start to decline in those systems. And when the mitochondrial substrate is less and your energy production is less, the associated effect is suppressed immune function. So there's a lot coming out now from many well-known people out there in the field of natural medicine about this term mitochondria and really looking to, that as a primary factor in, in anti-aging managing, telomere. They're looking at the DNA structures now that they're really getting detailed into that and have the technology to take a look at, basically chronological age versus actual age, or what your appearance might be. So that those things are really becoming popular. And as far as the cryotherapy, whole body cryotherapy, yes, because at that 2.5 minute heading into a 3 minute interval, it's not uncommon to see a shivering response, and that shivering response produces the force of the body to try and warm itself back up. And so that the human frame, in its effort to keep itself warm and in that survival mode, will tend to increase browning of the fat or increase the mitochondrial substrate over a period of time. So that's certainly another area that's going to be talked about and dove into quite a bit, I would think, in the next few years.
Yeah, Dr. Ron, do you do any nutritional workups with people to try to enhance their health in addition with the cryotherapy?
We do. I mean, my new tagline has been transforming lives, and so we're really looking at not just the ability to relieve aches and pains, but again, getting to the root, the root cause. So look at where someone is in their lifestyle. Are they active? Are they exercising? Are they a sugar burner, or are they a fat burner? And kind of our new movement, or certainly my push in the last 6 to 8 months, has been moving toward time restricted feeding. And getting back to kind of the primal design, primitive design of hunter-gatherer and timing of the eating and the types of food choices. So we try to keep it not so complicated as well. So we try and bring in some very simple concepts to not scare people away, so they don't get any benefit from some of the ideas that we have to share. So we try to start out really basic and simple, and kind of my whole nutritional realm is designed to be not difficult, but to start someone to ease someone into it, very gently, so that they can be successful and, have some tools to transfer out and continue on their own once they're done. Typically might be a 6 to 8 week kind of run or period with us. And then, they can find whatever tools like cryotherapy or chiropractic or whatever have you, to maintain, their state of health from a physical perspective, if it's, if we're talking about, pain or just longevity.
So you're recommending very strongly that they hold off their Dunkin' Donuts at least till 1 o'clock, right?
That's how we start. That's literally how we start. We don't even ask them to stop the Dunkin' Donuts, but we ask them to do just what you said. Funny enough, that's how I start out.
Just one cream donut, I'll be happy.
So Dr. Ron,
when you do chiropractic, Dr. Ron, you do the chiropractic after you do the cryotherapy? Do you,
more
do you have
times
to
than
wait
not.
Time?
Not necessarily. More times than not, I will see someone after they do the cryotherapy, because once we cool them down, the chiropractic is going to increase circulation and kind of enhance the warming up process. So just kind of from that perspective makes sense. But then again, depending on, that we have walk-ins for cryotherapy. So if that happens, and just depending if I'm already with somebody or not, we'll do what's in the best interest of our schedule. I don't know that it's that critical. I've been asked that question. Patients have asked me that question. I don't really have a huge preference, but somewhere in the realm of common sense, as far as just when someone's cold, going through the cryotherapy and in the process of warming back up, the chiropractic is not such a bad thing to do afterwards. But I don't really know that overall it makes that much of a difference. It's more just that process of warming the body back up, which, by the way, only ends up taking about maybe 3 minutes. Certainly by 5 minutes, they're very, very adapted. Their skin temperature is back to normal and all that. So the clients are very comfortable at that point.
And would you say that they are happier, and do you see a change in their mood when they come out of the sauna?
I really do. That's probably one of the most exciting things for me. Seeing people come in that are a little bit either just tired, or either a little bit depressed, or just not thinking this is going to be a thing that's going to help them at all. Kind of poo-pooing the fact that the cryotherapy might be something that might actually help them, and then watching their face literally change when they come out and come up front. We typically do about a 3-minute round of whole body vibration, basically for what I just mentioned about following a whole body cryotherapy session with chiropractic. If they aren't seeing me at all for a chiropractic, they'll get on a vibration platform, again, for the purposes of expediting blood flow through their feet and through their legs and stimulating the nervous system and lymph flow and what have you. But yes, you will more than common, anyone in this industry will definitely account for, you can see in people's faces, just they look lighter, they're smiling more, just their overall affect changes. And that's, for me, that's really what I love watching.
Yeah, that's great. And when I'm down at your centers, that's what I see. People coming out smiling, full of endorphins, ready to rock and roll. Dr. Ron, we have a couple people. Maybe they want to ask some questions. We have a 215 number here. Any questions from you for Dr. Ron? No problem. I appreciate you listening. Thank you so much. And 561, any questions for Dr. Ron? Okay, I guess no questions from the two I picked. Okay, so Dr. Ron, I am really just charged up about cryo because of the mitochondrial excitation and the fact that every time they come back, it looks like they, to me, when I'm down there or up there now, they can take more cold than they could initially. Do you find that that's the case?
Yeah, I would say, not always, but more typical than not. I would say you're 100% correct. As people go through, typically by the time someone's through their minimum of 3 to 6 sessions, they are more tolerable. The only issue there, and I totally agree with that, the only issue is when we started out, we were running at higher temperatures, and now I've kind of made it to the point that it's really quite comfortable all the way through. But it's still, the last 20 or 30 seconds are still pretty intense for the majority of people. So, yeah, that last 30 seconds tends to be much more comfortable and much more easy for anyone to follow through as they get through the 3rd, 4th, 5th session. So you definitely do see that adaptation process and the body building up, its tolerance to those stresses.
Yeah, Dr. Ron, do you find at the end of like 3 to 6 sessions that the athletes have more endurance as a result of treatment?
Well, yeah, I mean, they definitely do. The interesting part about that is they tend to have more endurance after the very first time they come through. The ones that have gone back to train in the afternoon and been in the morning, I've heard over and over again how their workouts were intensified after doing the whole body cryotherapy. So that rapid recovery, that vasodilation or vasoconstriction, vasodilation effect of the noradrenaline and what have you, looking at that circulatory response as well, not just the reduction in inflammation. They really seem to get, quite a bit of increase in oxygenation to the tissues. So that is definitely something we're noticing.
Dr. Ron, cryotherapy is really, every place I read, every place I go, it's only 3 minutes. I think our audience has to know that. It's a 3-minute chunk of time out of your life. It's not a marathon office visit. And I'm seeing more and more about mitochondrial and boosting your health. And I'm wondering if you're telling people that they don't have to have rheumatoid or osteo, that this type of treatment, if they give it a try, can improve mitochondrial function and their metabolic efficiency.
Well, yeah, we do. As a whole, in trying to, my big push right now more than ever is really getting my current clientele to spread the word, and we've done different things to help that out. But essentially, the general public as a whole really isn't aware of why they would do whole body cryotherapy. So it is a task, I think, as we proceed, and some of it will come on automatically as it becomes more and more popularized, which I'm certainly personally seeing a dramatic increase in opening of cryo centers. And my hopes are just that the centers that open do things the right way so that we continue to develop a good thing and not try and push the envelope when it's unnecessary as far as the advances in the technology and the cold. But certainly when we have people come through our centers, that's something I'm talking about all the time is, just some of the things I'm learning about in anti-aging and kind of the sidebar, the secondary effects of better sleep, better energy, softening of the skin, lessening of the cellulite deposits for the ladies. So there's a lot of just even aesthetic things that are really being noted and discussed and being seen, which are really fun. And then overall, looking at the ability to, clean out the body from a cleansing perspective is something we get into, whether we talk about, because we have people that are sometimes very well versed in this industry, like you talk about on your show every week, and we'll hear the term reactive oxygen species, we'll hear about autophagy, we'll hear these words that were really never talked about much before, about how the body using hot and cold technologies amongst nutritional changes can really cleanse itself and remove debris that can become quite damaging over time if that doesn't take place. So there is some really
Dr. Ron, I had a quick question. Is there a wait period, let's say, between treatments? Do you recommend once a week, twice a week, or?
Yeah, that's a great question. I mean, you're going to get different answers probably from different people in the field. For me, the way I look at it is I typically like a 3-day-a-week program. So, for example, generally be a Monday, Wednesday, Friday, because it's been my opinion that I like the body to equilibrate on day 2. If they come in on Monday, I don't know that I always want to continue to push the adrenaline system or push the body and augment the body's natural response. So I typically am very comfortable with having that every other day for 2 to 4 weeks, and essentially reevaluate it the 2nd and 4th week just from a symptom perspective, and if not, as well as a clinical perspective, if they're seeing me for that. Because the one thing also to mention, whole body cryotherapy in this country is really still claimed in the fitness realm, so it doesn't require a medical exam. So people come in and aren't being diagnosed with a specific condition through myself or one of our other doctors, but may have been diagnosed by their current physician, but still they can come in for whole body cryotherapy without going through that whole medical route. So they can fill out a waiver, go through the cryotherapy, and just see for themselves how they feel and identify with that.
So, Dr. Ron, if somebody wants cryotherapy and they're in Florida, how do they get a hold of you? Or if someone wants you to set up a center for them, how do they contact you?
Yeah, so I'm pretty easy to find. I've become pretty popularized on the internet there. So if you type in, Dr. Ron Repice, or our website is Cryo, CRYO Naples. We also have Cryo Fort Myers for those that are up in that area, in my immediate area. So cryonaples.com, or certainly you can always call our office. And our phone number here is 239-658-COOL, which is 239-658-2665. But the easiest way is probably just to Google us on the net.
Okay, and are you available for consultation with spas and whatever they want to put these units in their facility?
Sure. Yeah, we're very open to that.
Okay. Dr. Dan, any questions for Dr. Ron?
Yes. Have there been any psychological problems that have been helped by this type of therapy, like people that are having marital problems or even sexual problems? Let's get into that a little bit.
Well, yeah.
Seem to help any of this, or as you get older, to increase the function of the situation?
Well, Dr. Dan, I have a special unit for guys over 70 that it's a 10-minute thing, and you stay stiff for 2 days.
Yeah, we put your head in, Dan, and no extra charge.
That's what they call localized treatment.
But have you heard of anyone who said that this has helped our marriage, or has helped our situation? And I used to be depressed, and I used to be anxious, and now I really feel a lot better.
Yeah, no, I really haven't had anything come up as of yet over the 3 years where someone's come to me specifically claiming any type of success in enhancing their relationship. But the one thing I can say is just controlling stress, and some of the things that we do as a whole in our centers is relaxation, and part of the education is stress management. So I think just from some basic coaching perspectives that we just automatically incorporate into our structure, into our routine and the practice, certainly we've helped many people. From a funk standpoint, the main thing I would say is when someone's in pain, especially if it's it's back pain, things of that nature, that can create a lot of other dysfunctions in and of itself. So if we can get that inflammatory state down, then just having people more functional overall, their capabilities all the way around are going to tend to improve. And certainly the increase in general circulation, and I don't have anyone really that I could bring to mind on that realm, specifically with sexual functioning, but I would have to imagine that there's probably some good responses there too. Just something I'll have to look into, I guess, moving forward.
Oh yeah. I was serious about that from a medical standpoint. That's where my question came from.
Yeah, and we've talked about, and my father and I have talked about arginines. What's that?
I will have to ask Dr. Jerry what his idea is and see what's going on there too.
Sure.
Okay. Thank you.
Yeah.
Well, Dr. Ron, as we talked about, one of his mentors is Dr. Dan Kalish, and we had a show and a program on functional medicine. And so Dr. Ron is, well, you know what? Let me just brag about my son. He's board certified chiropractic neurology. He has a certificate for functional medicine from Dr. Kalish. He's certified by the American Back Society, the American Pain Society, and others that I don't even know about, but he really runs a first-class center, and from a knowledge base, it's not, he's been there for a long time. He's going to be there, and this cryo intrigued both of us when we saw it, and it is 3 minutes. That's the beauty of this. It's 3 minutes. You don't go to physical therapy for an hour. It's 3 minutes and has better results for back pain than physical therapy does. So, Dr. Jerry, what were you going to say, sir?
I was going to say, can you drink a cup of coffee while you're getting cryotherapy?
Well, if you want iced coffee.
Yeah, right.
Icicle.
Well, Dr. Ron, you really informed our listeners. That was a great presentation. Dr. Dan, Dr. Jerry asked some good questions, and then I'd like maybe you could come back again when we can get Dr. Kalish on, because he's always been a great guest when you and I were doing the program, and talk about the LEDs and the other products you have to offer for clients for either weight or slim and trim, whatever. I mean, you're a full service center.
Yeah, absolutely. Now we incorporate all of it together in a combination, because it all just works so beautifully together. We have a really nice, simple system now. Very effective.
So, ladies and gentlemen, you've been listening to Dr. Ron Repice from Naples and Fort Myers, Florida, Rejuvenation's Center, Rejuvenation's Chiropractic. I know his office number is 239-331-5886. And the cryo number, Dr. Ron?
Yeah, either one. The number you mentioned is that'll come up as well. The 239 is our area code, 331-5886. Or the number I mentioned is our vanity number because it ends in the word cool. That's 239-658-2665. So 658-2665. Either way, you will speak to someone live 24 hours a day, and we can get you set up for an appointment. And as you've already clearly mentioned, the beauty of the whole body cryotherapy is a new client from start to finish would be about 15 minutes, and a second session would be about 7 to 10 minutes at most, as the whole body cryotherapy routine in and of itself is only 2.5 to 3 minutes. So that 3-minute time frame is something I've always loved about it. It's fast and it's effective and it's affordable for people to get in and enjoy some natural pain relief.
Okay. Well, thank you, Dr. Ron. And I'm going to let him go. Dr. Dan, you're okay? And no follow-ups, Dr. Jerry?
Yeah, one quick question. The duration from the treatment, like with lower back, do you find that the pain keeps away for a week or two, or it takes multiple treatments to get that type of result?
The majority of people in the first, second, or third time through whole body cryo will typically see a dramatic improvement in their pain on average. And I have to say very confidently, typically within the first session, there is a symptomatic improvement even from day one. And that's probably, again, other than seeing people and the excitement in their eyes and the affect and all that is another component. But it also is inclusive of just a human being realizing that, hey, this this has alleviated some of the symptoms, if not, a higher level than just a little bit. We've seen cases where people come in with, say, I had a gentleman come in, not to go off on too much of a tangent, but I had a fighter come in, it was 2 weeks ago now, with a groin pull and hip pain, and he was limping in, and I watched him come into our waiting area doing a kind of a circular kick with his leg and basically saying, I'll be darned, I don't have any more pain. And he was that shocked that he could come into the office limping like that and walk out before he even walked out testing his hip and thigh by performing a martial arts maneuver, a kick. So we certainly get those incredible cases. But within those first 3 cryotherapy visits, even my neuropathy cases, I've been really getting great results. So in that first to second week, typically we're seeing some really, really nice changes. And as far as sustainability, a lot of it's going to come down, as you know, lifestyle, depending on what maybe brought it on to begin with. If you're a fighter and they keep doing intensive training, then they're going to need some management because the likelihood of them constantly re-aggravating, re-injuring, restraining is going to be there. So there's those concepts to consider as far as sustainability. But from just an acute or mild inflammatory state, it could be very, very long-lasting, even as little as a few weeks of whole-body cryotherapy.
Great. Thank you so much.
You're welcome.
Okay, well, I think you've been listening to Dr. Ron Repice from Naples Cryo and Fort Myers Cryo. And Dr. Dan, did you want to get in there?
Yeah, I wanted to thank Dr. Ron Jr. for a terrific explanation of this cryotherapy. And I guess I asked the questions I had in mind, and I got good answers. So thank you very much. Appreciate it.
Yeah, thank you for having me on. It's nice to be back on the show.
Okay, so I'm going to leave you with one thing to do. Get a date from Dr. Kalish for us.
Will do. Shouldn't be a problem.
Okay. All right, thank you. Thank you, Ron, and we will have you back.